Welcome to Saving Lives in New Jersey with the COVID-19 vaccine, a town hall uniquely addressing Black and Caribbean communities in the state, presented by the New Jersey Department of Health. I'm Dr. Kemi Alli, CEO of Henry J. Austin Health Center in Trenton, New Jersey, and the moderator of this panel discussion. Joining me to discuss the COVID vaccine are Dr. Amisaka Nayeku, infectious disease specialist from Rutgers, New Jersey Medical School, University Hospital in Newark, New Jersey. Dr. Chris Purnell, Chief Strategic Integration and Health Equity Officer at University Hospital in Newark, New Jersey. And Dr. Harold LaRoche, Emergency Room Physician with JFK Medical Center in Edison and New Jersey Chapter President of the Haitian Physicians Abroad. Welcome, welcome, panelists. We'll jump right in. And the first question I have is from Talia in Maplewood, New Jersey. And she asks, what information do you think we can provide to Black and Brown communities that may make them more inclined to take the vaccine? And I'll ask this of you first, Dr. LaRoche. What are your thoughts around this question?
Thank you very much for having me be here with you today and with all of you guys to have a real discussion about what's going on with COVID. I'm here down to earth, so this is very important questions. And I think the most important thing is that we have to stop making sure that the people know the vaccine is safe. Number one point. Number two, there is so much misinformation out there commingled with valid information that nobody knows exactly where they stand. Number three, program like this is what we need. We need to have a real conversation with the population to let them know, here, this is what we know, this is what we don't know, and also be transparent on how we go about the information. For example, I'm a COVID-19 survivor. So my own experience when I speak to patients is to tell them, if I knew what I know now, I would have been online the first time to get the vaccine, because this disease is no joke. You don't want to have it, because from what I've experienced, this is the last thing I want anybody else to experience. So that would be my information to them. Just capsize it, make it nice and succinct, and let them know this vaccine is safe and it protects you.
Thank you. Thank you so much. I think this next question might be for you, Dr. Nyaku. It's from Irina from Newark, and she says, because the vaccine was rushed, no one has been able to study potential long-term side effects. How much of a concern is that? What are your thoughts around that?
So in addition to being a physician at University Hospital, I'm also a clinical researcher, and I participated as one of the investigators for the Moderna vaccine trial. So we hosted that here at University Hospital in conjunction with Rutgers, New Jersey Medical School in Newark. So I would like to say, because I do hear a lot of people that have concerns that the process was rushed, but it most definitely has not been a rushed process. We've had, being able to make these mRNA vaccines, that's been something that's been 10 years in the making. We've had 2 other SARS-like outbreaks that have happened, SARS-1 and MERS, and those are both related to the SARS-CoV-2 virus. So that gave us a leg up to be able to understand how this virus makes people sick. And additionally, what the government has done, in addition to other government agencies in other countries and the World Health Organization, has been when you come together, you pool all of your resources, you say, okay, you know what, my researchers that normally are HIV researchers, so that's normally what I do, all of my immunology researchers, all of my respiratory virus researchers, stop what you're doing and focus on one thing. So it's all hands on deck. Everybody's focused on the COVID vaccine. So you have all of those researchers focusing their attention on that, as well as all of this investment from the government for one singular cause. That's why we're able to go from, the pandemic starting in December to now having rollout of multiple different highly effective vaccines. So that, I think, is an important thing for us to think about. But what the person who posed the question is correct is that we do not have long-term information at this time about side effects. And I would say that it's less about long-term effects, long-term side effects that we are continuing to study because those vaccine trials are still ongoing. But it's actually more to understand how long do you have protection? How long does the vaccine work to keep you from becoming, moderately, severely ill or potentially dying? So we know that usually if people are going to have side effects from any vaccine, that happens pretty early in the course. And we have a good amount of data showing that for the vast majority of people that are getting these vaccines, they're not having these side effects.
Excellent. Oh, there's so much good information. There's so much good information. And I'm going to correct myself because I know people from the community, they're like, that was not my question. So that question was actually from Donna in Jersey City. So thank you, Donna, if you're listening or watching. And Irina from Newark. Now, this is Irina's question. What role do primary doctors have with assisting with the mistrust and resistance in communities? And I'm actually going to pose this one to Dr. Purnell. What are your thoughts around this issue of mistrust and how you think physicians might be able to assist with that?
Fabulous question. It's a question that we have to be able to talk about head on. And I heard some colleagues say the other day, and I want to interject this here, it's not so much that Blacks and Browns are vaccine hesitant, but that they're historically aware. And that historical awareness is awareness of historical injustices, whether we go back to enslaved Black women who were subjected to medical experimentation and exploitation at the hand of Dr. Sims, where he practiced gynecological procedures on them without anesthesia and without their consent. Or whether we talk about Henrietta Lacks, right, a Black woman in segregated Baltimore who had metastatic cervical cancer and had tissue samples taken unknowingly from her womb. And those tissue samples, known now as HeLa cells, going on to be one of the most productive and robust cell lines in cell biology research. Or whether we're talking about the infamous Tuskegee syphilis study, where Black men were studied for the natural progression of course of syphilis and treatment was knowingly withheld. All of those examples are toxic, right? They are toxic to our communities. But it's not just what happened in the past. It's what we see happening in the present day. It's the current disparities, right? The Dr. Susan Moores that we see on the news, a Black woman physician in Indiana who had to resort to social media to say systemic or institutional racism is interfering with my treatment of coronavirus. So think about that collective trauma on the psyche of Black and Brown persons, and then think about that on the backdrop of record levels of national skepticism, right? Questioning our public institutions. We're in an unprecedented public health crisis. We have a pandemic that has ripped across the globe in a little bit over a year's time. So what I tell people is you see the collision of two pandemics, pandemic of systemic racism, which I described with those examples, and the pandemic of coronavirus being that fast pandemic, systemic racism being that slow pandemic, and the collision of that causes, or the collision of that is almost a maladaptive or adaptive, I should say, response. Can I trust the science? Can I trust clinical research? Can I trust the healthcare system more broadly? And this is why primary care physicians are key. They are assets. They are valuable, trusted messengers. Oftentimes we talk about person-centered care or patient-centered care, and it's that shared decision-making, that trust that happens between a person and their primary care physician that we know is actually useful in helping someone along their decision journey. So I would encourage primary care physicians to be educated about the vaccine thoroughly, and then to be able to speak about it in plain spoken layman's terms to validate fears to validate concerns, to even validate skepticism, right? So that people feel like I can bring my truth to you as my primary care doctor, then you can help me navigate the science. And then together we can make a decision and I can operate in my self-efficacy.
Excellent, excellent. And that is such a journey that I think, as you said, every physician is almost obligated to go on and to determine, as you said, read the information, the literature, the studies, the articles, so that you really can be a guide for our community. I know that was one of the things I did really early on, because I had my questions too, like everybody else. And really, once I read the information, I read the data that came from the Pfizer and Moderna trials, because they were so transparent. That I then could make a comfortable decision for me, my family, my friends, and therefore can speak about it in our community. So just excellent, excellent points. So this question is from Patricia in Inglewood, and she asks, are Black and Caribbean people more sensitive to the COVID-19? And I'll ask Dr. LaRoche to answer this one. What are you seeing in terms of Black and Caribbean individuals being more sensitive to the COVID-19?
Well, let me, at first, when I saw that, I heard that there's one distinction I will make. There's no such thing as Black and Caribbean. We're all Black. So that's the first thing we got to start saying, this distinction that's being done. We're all Black. Now, the reason sometimes because of healthcare disparity in terms of what's available to us, that's what may make us more susceptible one way to the other, whether it's the coronavirus or any other virus. But when you look at the disparity of healthcare, and that's the problem. So therefore, this is the first thing that we got to make sure that we tell people that, this there's no such thing as, being more sensitive versus, it's just because of your background, how you've been raised in terms of healthcare. Have you gotten all your shots on time? Have you been seeing your doctor on time? The follow-up that you do compared to your white counterparts, that's what may make you more sensitive. Not only that, but Black in general, we suffer from diabetes. We have hypertension. We have kidney problem. I, for example, I have chronic kidney disease. So when the virus got into me, the virus jumped in joy because I have other problem that makes it can hurt me more. So these are the kind of things that we have to let the population know. No. There's no such thing as, Black, brown. No, we're all Black. However, the health disparity that we've been facing, like Dr. Purnell mentioned, for so many systemic issues, racism, that's what's really got us affected. So therefore, we're being affected more by the coronavirus than anybody else.
Excellent, excellent. So I'll ask Dr. Inyaku this question. This is from Shayla from Livingston, New Jersey. And as you mentioned, working on the studying of the COVID-19 vaccine, that research. And her question is, what risks regarding younger women should they be considering if they want to start families and taking the vaccine? Are there any effects on fertility? That's her question.
So this is an important area where we don't have great information to say that there is no issue. And a lot of that comes around, especially for women that are pregnant or for women that are breastfeeding, because women who were pregnant or were breastfeeding were not allowed to participate in these vaccine studies. And so that's something that we continue to have questions about. However, these vaccines work very similar in terms of the side effect profile to many other vaccines that we have, that we routinely give, such as the flu vaccine or the Tdap vaccine that we routinely recommend pregnant women to take. Because one of the things that is becoming clearer and clearer is that when a woman is pregnant, the chances of having a poor outcome if she gets COVID is definitely there. So we exist in this place where we're having to weigh the risk and the benefits. And it's especially hard right now too, because most recently, the World Health Organization came out and said that pregnant women should not be vaccinated. And then they came back and they said, talk to your doctor about it. So that does, it causes a lot of confusion. But here in the United States, the American College of Gynecology, of Obstetrics and Gynecology is very much advocating that pregnant women should not be excluded. They should definitely have access to the vaccine because, like I said, we see these very concerning signals in terms of, preterm birth and hospitalization around women that are pregnant in COVID. And we've seen that for things like getting influenza. And so at this point in time, we do not want people to not get vaccinated. We definitely want people to get vaccinated because we have very little concern that there's going to be some effect on fertility or if the person is pregnant in terms of the developing baby. But that is a place where we don't have that great of science at this time.
Yes, and thank you so much. And that is what I tell almost everyone I speak with, that as far as I know, there is no individuals who are excluded at this time from receiving the COVID-19 vaccine, with the caveat that if you have concerns, whether that's allergies, anaphylactic reactions, pregnancy, breastfeeding, that really, if you have cancer and you're on chemotherapy, no matter what it is, speak with your provider. Speak with your primary care provider, have a discussion. As we said, get all the information you can and then make an informed decision. So thank you, that's just perfect information. And I want to come back to you, Dr. Purnell, and you mentioned about the history and how that has really shaped us as individuals, Black and Brown. So what do you think are some of the key elements now to turning that around, to gaining that trust in our communities?
Excellent question. I usually lead with this. It is the responsibility, it is the accountability of healthcare and health systems more broadly to demonstrate trustworthiness. When institutions that have institutional power, right, that have system power, demonstrate trustworthiness, then individuals in communities are more apt to grow in trust, right? Too often, I think Black and Brown folks are made to feel that it's your responsibility just to trust us. No, and that's what's gotten us into this conundrum. It's that disconnect, right? Talking about those systemic forces, whether it's systemic racism or other forces like sexism and things of that nature that have reared their ugly head in medicine and led to implicit biases. It's very important that systems have these honest and transparent conversations. Frequently, when we go into community, whether virtually or whether over the phone, speaking with constituency groups around University Hospital, I start with making sure there isn't any stigma. There isn't any stigma or othering of people because they have a belief or they have a question or they have a fear or they have a concern, right? That we see each other across the table, that we see one another's humanity. Allowing us to see the person's humanity, we then begin to understand their lived experience. And in understanding their lived experience, we understand the factors that actually contribute to that sense of skepticism or that sense of, I don't know if I can trust you. So when I can come to you, and I can come to you in humility, and I can come to you honoring and respecting your dignity, that's one way I signal to you that I'm trustworthy. I'm demonstrating my trustworthiness. Then you're more likely to say, I can trust information coming from this person. Also, when institutions, when systems, or when public health professionals step forward to provide necessary public health guidance, we need to see persons of color in those roles. We know from the literature when you have a concordant relationship, meaning the provider or the professional looks like the person in community that you're interacting with or that you're speaking to, that trust goes higher. Why does that happen? Because there's this social and cultural fluency. That's how I like to term it. There's a fluency between between the provider and the person, right? So that's the second thing to do. One, institutions demonstrating trustworthiness. Two, institutions amplifying and elevating the voices of Black and brown physicians, Black and brown public health professionals, Black and brown providers, whether they're nurses or respiratory therapists, others that people can see themselves in and begin to identify with. And then three, we want to make sure that the message is health literate, right? That we're not talking beyond people or over people, but that we're talking, again, I'm going to say in plain spoken terms. That's another way of demonstrating trustworthiness, right? I'm honoring you. I'm honoring how you best receive information. And it's going to be very important for institutions to have those health literate, socially, culturally fluent message and socially, culturally fluent messengers. Then that allows for a bi-directional dialogue. And that bi-directional dialogue becomes the foundation that trust is built upon. Then I can say, okay, doc, I hear you. I hear the risk versus the benefits. I hear the experiences, the narratives that you're unearthing, and I can identify with that narrative. Okay, doc, I can begin to trust the relationship of exchange that we have.
I'm so glad this is this will be recorded so people can listen to what you just said over and over and over again. Just very, very powerful, and what a clear roadmap you just outlined there. And that question was from Horatio in Hopewell Township, and I think you just answered his question superbly. So now we have a question I think is one that's on a lot of individuals' minds, and this is from Talitha and from Princeton. And the question is around why does it seem that people are reporting suffering more debilitating symptoms after the second injection? And Dr. LaRoche, I'd like to get your thoughts on this. You probably see this quite a bit from the emergency physician perspective. Why is that?
I think it's a very valid question, and the way I explain it to people is as follows. The vaccine introduced a foreign object into your body. This is the first time the body has seen it. So therefore, the body is starting to make a defense mechanism against that object. Because let's say, for example, you get so many millions of particles. So the body now say, okay, I recognize it, I'm ready. Now, next time they get the vaccine again, the body says, whoa, I'm seeing the same guy again, let's mount a better defense. Not knowing that it's being primed for the next time you really make the virus. But however, the body, the way it looks at it, it says, hey, this is the second time I'm seeing the same thing. Therefore, I'm making a more robust defense. That's why you end up with fevers, shaking chills, or some other side effect that usually we know it's coming. Some of them we may not necessarily know. For example, somebody comes suddenly with a Bell's palsy that people on the internet will say, well, look what happened to me. That's when, again, we got to tell the primary care provider, hey, you have to let people know some side effects are expected. One of the things I tell people is that you take Tylenol for a headache. They said, yes. I said, do you know Tylenol can kill you? If you take too much Tylenol, it will kill you. So everything has side effects. The thing is, you have to look at the perspective. What's the good and what's the bad, and weigh the one that's the best for you. But definitely, it's a very, very important question in terms of why our body, when it gets subjected to the same process a month later, in case of Pfizer, 21 days later, Moderna, 28 days later, now the response, it's much more robust, and therefore we see the side effect that we see now.
Can I add something to that, Dr. Alli?
Yes,
something
please.
brief to that. I just want to just to help share an experience that I had. So I actually participated in the Moderna COVID-19 vaccine trials. I lost my father to this pandemic. My sister, who is a breast cancer survivor, is what we know as a COVID-19 long hauler, 10 months since her infection, and is just nearing ready to return to work. I lost 2 cousins at the turn of the year also to coronavirus. So when I tell people that the epicenter landed in New York and New Jersey, I actually say it landed on my family. So think about that as that fire in my belly that said, I want to be a part of the solution. I'm a public health physician. I'm a Black woman who's been impacted, and I want to be a part of the solution. happen. So unbeknownst to me at the time, because I was double blinded, meaning I didn't know whether I got placebo or the active vaccine, or the researcher leading the study team didn't know. And so in my first shot, it felt like the flu vaccine. And I want to explain it that way because some people have an experience with it. And I got some mild side effects. I got pain at the injection site. I got tenderness, but it wasn't to the point where I couldn't do my activities of daily living. I still was able to go to work. I was still able to do my routine. I also developed headaches. I had a past history of sinusitis and had a past history of anemia. So I'm used to having headaches, but those headaches lingered for a couple of days. And maybe my temperature just bumped up a little bit, but never a frank fever. The second shot, I had a different experience. And mind you, I didn't know at this point whether or not I had received placebo or whether I had received the vaccine. And I was very fatigued after that second shot. At the end of the day, literally, I sat in my car for 20 to 30 minutes. I just had no strength to move. And I think it's important, the more that we can talk about the side effects and describe them as routine, and describe them as something that is a part of the body's normal inflammatory process, that we begin to demystify, to decode what it's like to get vaccinated. Now, while I had those symptoms, again, headaches appeared, but I had that severe fatigue the second time. My temperature bumped up even a little bit higher. I felt better in 24 hours. The headaches maybe lingered for about 2 to 3 days, but then ultimately they too got better. And so I liken it to when you go to the gym and you work out and you come home, your body's sore. Doesn't mean that you've injured yourself, but it does mean that your body is working, right? Your muscles are expanding and contracting. The same way, when you get inoculated, when you get vaccinated, you get these side effects. Doesn't mean that you're infected, doesn't mean that you're sick, but that your body's immune system is working.
Excellent. Thank you both, doctors. And I have to say, having received the vaccine myself, I experienced what you described. And it's so interesting when you can speak to it from that point. You know, the first time when I got the first dose, my arm was a little sore, just as you said. And the second dose, I was so tired. And it's so interesting because you read about these things, right? Like, we're physicians. We know this is what it says. You can have some fatigue and you can have some soreness and a little bit of fever. And when it happens, you're like, wow, I'm really tired. Like, no, I'm really tired. Like, oh, I got the shot yesterday. Okay. And you're right. The next day you feel much better. And the following day you're back to normal. So exactly right. We really have to explain so people have a real expectation after they get the first and the second dose. And it's up to us to do that. Yes. Thank you so much. So I have this next question. I'll open it up to the panel. There have been some rumors about deaths after the COVID-19 vaccine. Does anybody want to tackle that one?
Sure,
Okay.
I can.
I'll go with Dr. Nyaku. I think you were first. Mm-hmm.
All right, so I'll start first. So I think I think that the questioner framed this really nicely to say about rumors, because that's really where we need to move from rumors to facts, right? So I think that this illustrates the importance of getting information from trusted sources, asking people where they're getting their information from, and making sure that you get the whole picture about what's been going on. Because somebody, for instance, posed to me that there were, that it was going around that there were multiple people who died after receiving the vaccine in a Scandinavian country. But one of the things that when you dig deeper into that story, so it was very elderly nursing home patients, and they were going and they were vaccinating them. And the number of people that they were saying maybe, you know, some of the side effects that they experienced because they were extremely elderly and had multiple comorbidities. So maybe that fever, you know, caused problems and hastened their death. When you look at the number of cases that they were assigning, maybe the vaccine had some impact, was so small in comparison to the number of people in that group that were dying every day. So you can hear somebody give you a number, but if you don't have the full context, that can cause some issues. Now, one of the things that is going on and is being evaluated is whether or not the vaccine is causing a very rare, incredibly rare side effect, but again, a known possible side effect of any vaccine, which is having low platelets or thrombocytopenia. And so right now they are looking into that to see how often is that occurring, because there may be one death. So there is a death in which there was very low platelet counts. But the question is, was this a condition that this person had? And again, that can be a silent problem until somebody gets sick from it. And getting the vaccine was a coincidence, or was it related to the vaccine? So that again, so there are many things that we will continue to investigate. But at the current time, so today, being February 9th, there is nothing that has risen to the level that would have the FDA or any of the governing bodies say that we need to halt vaccination, because now we've exceeded that risk benefit threshold, that now we're doing harm to our society, harm to the people that we're trying to protect, rather than providing them with the protection from keeping them out of the hospital from severe COVID.
Thank you. Thank you. And that question was from Johan from Hamilton. So thank you for that. And I got to get this question because this is from my Trentonian, Tina. So Tina from Trenton asks, so there's this RNA, she said RNA, RH factor. I think she meant the messenger RNA. But how does this vaccine, or does this vaccine, I should say, attach itself to our DNA? And she's hearing a lot of different things and confused. And I think this is another question for you, Dr. Nyaku. So what is this messenger RNA, and can it get into our DNA? Can it change things? I think that's a question of a lot of people.
Yeah, that is a very common question. So I think that the best way to describe the messenger RNA is it's the recipe. So we're giving the body the recipe to fight off the virus. So like Dr. LaRoche had said earlier about, your body, the way that any vaccine works is it gives you something that your body isn't used to seeing. And our body's response is to make antibodies. So the immune system turns on, it makes those antibodies, and it fights off, this thing that shouldn't be in our bodies. And so what the messenger RNA is it's actually the recipe for the body to make one of the proteins that's on the outside of the SARS-CoV-2 virus that causes COVID. Our body makes a little bit of this protein, a very small amount, and then all of a sudden our body's like, this isn't normal, this shouldn't be here. And so then the immune system turns on and makes those antibodies. And so that's that messenger RNA dissolves. It doesn't last very long, so that's why it has to be stored at incredible freezing temperatures, because it will dissolve in minutes. And so after our body has made this small amount of protein, it will dissolve, and it does not integrate, so it does not join with our DNA. That's not what happens. It's just a recipe. The body makes a little bit of the protein so that then the immune system will turn on and know how to fight off the SARS-CoV-2 virus.
Can I just add something briefly to that?
Yes.
I think it's this little reenactment that I usually do in community when I'm talking about it. If we draw this circle, right, and this circle is the cell, and I put my fist in the middle of that and I say, this is the nucleus, and DNA lives in the nucleus. Messenger RNA normally occurs in your body. What the vaccine is doing is making a synthetic messenger RNA in the lab, injecting that. I've heard people describe it as a Snapchat message, right? A message that's there, gives you instructions, gives you recipes, and then goes away. It doesn't get into the nucleus of the cell. It's in the sticky substance, the cytoplasm, right? So I want people to know it's a separation even within the cell. There's another way to understand those are two different processes that are occurring.
Excellent. And I've had some skeptics on that, and my comeback is, it's sort of, there's science, and there are some facts, and there are some truths, and when we first discovered that the world was round, and there were many people, right, that believed the world was flat, and it indeed is round. If you want to believe it's flat, we can, there's nothing we could do for that. But the same issue is you can go from DNA to RNA, and RNA cannot go into the nucleus, as you mentioned. It can't go into the center of the cell. It doesn't work that way. It's like there is a sun and we revolve around the sun. That's the way it works. That's the science of it. So yes, thank you so much, because there are just some things that are scientific facts that cannot happen. And so messenger RNA, as both the doctors explained, cannot go into your DNA. Thank you. So moving on, let's get to a couple of South Jersey questions. Dr. LaRoche, let me ask you this one. If you tested COVID positive, how long should you wait to get the COVID vaccine? And I think this also ties into, if I've had COVID, should I get the COVID-19 vaccine? And this one is from Yvette in Pennsauken.
My belief, at least from what I've read, if you have test is positive, before you can get the COVID vaccine, you should wait for at least about 4 weeks before you can get the vaccine. Now, if you tested positive for COVID, they said, and then you had the disease, then they said you should take the vaccine. Let me use myself as an example. I tested positive, so I had the COVID. 8 months later, I took the antibody test. I'm very high in antibody. Now, I spoke to some of my friends in my infectious disease. They said, well, there's two things you can do. You can take the vaccine and it's like a booster, or you can just wait and see how your immune system does. So I chose the latter. Why? Because I wanted to provide the world with a little experiment on my own. So I could take the vaccine right now and make a booster. Now, the thing is, which one do you take? Do you take the 2 doses, or you wait for Johnson & Johnson, which is only one vaccine, which is a booster? So there is not a consensus in terms of which one you basically take. What I choose to do, I choose to wait 3 months from now. I'm going to test myself again, because I'm going to let the world know how long it really lasts your immune system when you get the disease, because right now nobody knows. So the same way, if you get the vaccine, nobody knows how long that the immunity will last. Again, for our listeners, you have 2 kinds of immunity. You have natural immunity when you get the disease, or you have the immunity that we give to you by a vaccine. Both of them give you antibody. Now, which one lasts longer? Some vaccine, for example, measles vaccine may last forever. Some other vaccine may last even more. And some, you get the disease, you can even have immunity for much more longer period of time. So right now, like I said, the answer is not yet out, because we don't know. There's too little time for this. So it's a matter of seeing what's going to happen. But right now, the recommendation, at least from the CDC, is if you do get the disease and you're positive, you should still get the vaccine, because they believe the vaccine may increase your effectiveness, especially if you have 95% effectiveness, since we don't know if you have the disease, how well the effectiveness is. And then one myth also to let people know is that just because you had the disease, that doesn't mean you cannot get it again. Just because you had the vaccine, that doesn't mean you can get it again. I tell people a lot of time, if you look at chickenpox, I have kids that have chickenpox as a kid, but when they get chickenpox again as an adult or as an adolescent, it's not as bad. So therefore, you can get a disease event, even though you have natural immunity or immunity conferred by science.
Yes,
and just to add one thing to that, with the variants that are emerging, right? The variants that we know about, it is important, even for those who have had coronavirus, to consider and to get vaccinated, right? So the CDC is actually recommending that you wait 90 days if you had coronavirus and have been treated with monoclonal antibody therapy, or if you have been treated with convalescent plasma therapy. At a minimum, a person who hasn't been treated with either of those treatments, and that's an infusion, so you would know if you had that, you have to at least exhaust the quarantine and the isolation period. But I want to be very clear with people. It is very important to have the most effective and robust protection possible. And because we're still learning the science and we're still learning about the variants, the thinking is, even if you've had coronavirus, you should get vaccinated. And even if you're vaccinated, you should still wear a mask. So you catch that, right? So that's that double and building layer of protection. And I just want to make sure the public and the audience clearly understands that.
That is such an excellent point about the vaccine and still wearing a mask and just how important that is. And, someone had asked me, well, if I did get the vaccine, why should I still wear a mask? And, why should I still social distance? And I say, it's the same thing when you're getting ready to drive your car. You do make sure your brakes work. You do wear your seatbelt. You do change your oil. So you do lots of different things, right, to protect you on the road. Same thing. You're doing lots of different things to protect yourself. And so the vaccine is one, wearing a mask is one, washing your hands is one, social distancing is another. And you do all those things in combination to reduce your risk to as minimal as possible. So just another excellent point about getting the vaccine, but also wearing a mask, social distancing, washing your hands, and making sure that whatever location you're in has good ventilation. So let me as we come to the sort of few minutes left here, I'm going to ask Dr. Nyaku, as we look at the vaccine again, let me ask you, how do we really know it's safe? I know you touched upon this before, but this is a question from Donna in Willingboro. How can we be assured that the vaccine is safe for the community?
So I think that we have to think about what is the data that we have to this point, and then what are also the protections that are going on. And so basically thinking about what do we know right now and what is in place so that if there's a problem, we're getting that addressed. So the process for us to even be talking about widespread potential to get the vaccine is because there were several very robust studies that were done. And so when I say robust, I mean a lot of people were involved in those research studies. Like Dr. Purnell has said, she was one of the participants. So I'll put together the Pfizer-BioNTech and the Moderna studies because those are two very similar vaccine studies. So those two companies enrolled about 70,000 individuals. And of those 70,000 individuals who participated, initially half got the vaccine, half got the placebo. These are some of the largest clinical trials that have been conducted, period. Normally we don't enroll so many people when we're doing research studies, but we needed to do that as a part of A, figuring out if it works, and B, being able to see if it's safe. So those clinical trials, while the studies were going on, the investigators would monitor the safety of the participants with their research teams. And then if there were any issues, they would report that to the overarching teams. The overarching teams would then report that to the regulators. So we had this constant monitoring of the individuals that were happening while the studies were going on. And then when they got the information to say it works and it's safe, then it needed to go to another group, to the FDA, for all the data to be looked at. And so the people that were on the FDA review boards for the emergency use authorization had no involvement with the studies whatsoever. So they looked at all of that data and they came to an assessment. So that's what gave us the authorization to do it in this emergency use setting. So we've had all of this review and safety analysis. Now we've had tens of millions of people that are being vaccinated, and we have their providers that are monitoring them. The CDC is still monitoring what's happening if there are any vaccine issues that come up. The companies also are continuing to monitor if there's any issues that are going on. Because this is an emergency use authorization, the FDA is looking very closely. So all of this reporting is still happening. All of this monitoring is happening. So, everybody has spoken about, we see that there's some side effects that we saw happen in the research studies. We know that people are experiencing that in real life. And then there have been some things that have popped up that we had not seen in the research studies. but we know that can happen with other vaccines. So like the severe allergic reactions, Dr. LaRoche talked about the temporary nerve paralysis that we call Bell's palsy. We talked a little bit about the low platelet issue, the thrombocytopenia. So we are definitely continuing to do all of the monitoring, and in a lot of ways, there's a different kind of intensity around it because these vaccines have special authorization to be used in the general public. So I would say that we are, these research studies originally started in the summer, so we're almost 8 months of monitoring people for any side effects or severe side effects that are unexpected from these vaccines. And so that is reassuring to me. This isn't a situation where it's, you get the vaccine and then nobody pays attention. So there's a lot of monitoring that's going on.
That is, thank you so much, and that is so true. And I say the world is watching. So every agency in the world that monitors vaccines are doing just that. The world is literally watching what happens with these vaccines. So that's reassuring as well, I think. So thank you again. So I want to end on that note, thanking our panel. We've come to the end of our time. There's such an amount of good information, excellent information that was shared by our expert panelists. Again, thanking Dr. Nyaku, thanking Dr. Purnell and Dr. LaRoche for your time and your expertise. Thank you, thank you, thank you. I want to also say, if you want to learn more about the COVID-19 vaccine in New Jersey, you can do so by visiting covid19.nj.gov/vaccine, and that's a /. So we've come to the end of our town hall, and as we mentioned briefly, remember to physically distance, wash your hands, wear a mask. In fact, now I'm telling people wear 2 masks. And again, maintain all the safety practices that we know are going to keep us safe during this really difficult time. Again, if you're seeking any advice regarding the vaccine, you can, as we mentioned, always go to your medical provider and make an informed decision. Again, thank you, everybody. Thank you for watching, and stay safe.